Hey everybody, this is Dr. Nick from the Springfield Wellness Center, and today we're going to be talking about herniated discs and what we can do to help those. So herniated discs are a tricky problem to have and also a very painful problem to have. So with herniated disc, it's a more severe, it's basically the next step beyond a bulged disc. Some people call it a slip disc. So this is what a normal, healthy disc looks like. The nucleus is on the inside, and then there are fibers that hold the nucleus in place. I basically compare it to a jelly donut. So the nucleus is the jelly and the fibers are the donut. Each one of these discs correlates to one of the joints in the back between two vertebrae. If this joint becomes out of alignment or stops moving the way it's supposed to, this disc is not able to get the nutrition that it's supposed to. So the way that the disc gets the nutrition is a process called imbibition. Now imbibition works like this. If the joints are moving correctly, then each one of the discs are able to move, and they're able to suck water and nutrition in from the outside. If the joint becomes stuck or fixated and the disc is not able to move, it's not able to suck its own nutrition into the disc. So the disc does not have its own blood supply, so that process of imbibition is really important. So as the disc becomes less hydrated, it becomes more fragile. When it becomes fragile, the fibers that surround the nucleus start to tear, and the nucleus will take a path of least resistance and will head towards the outside of the disc. The problem is if it actually bulges, it usually bulges backwards, and it bulges into the nerve itself. When you hit that nerve, that's when people start to have symptoms like low back pain, and then also pain down into the hips and possibly even into the leg. Now, if enough of these fibers tear to where it gives the nucleus a path to the outside, this is what a herniation is. So the nucleus actually comes outside of the disc, and the piece that ruptures will just sit there on the nerve, and that's when people the pressure in the back is relieved, but the pain in the leg becomes usually very severe. So this is when they start to talk about surgery. It's probably best to try everything conservative before you attempt surgery, but this is what we want to avoid. So if that has happened, and you have a herniated disc, the three things that we do in our office to combat against that or to help heal that, we look at three different structures. So first we're going to look at the joints, because those are usually the cause of the problem because of that fixation in the joints that caused the disc to be unhealthy in the first place. Then we're going to look at the disc itself, and then we're going to look at the muscles surrounding it. So if there's any type of tightness or if there's any type of weakness, we want to address each one of those three. So the first thing that we do is with the joints is we'll be adjusting things. So we're going to look to see if there are any misalignments or any fixations. Now normally when people have herniated discs, they're in a great amount of pain, and so we have to be real gentle with the adjustment. So we have a couple of different techniques that we use to be able to do some lower force adjusting abilities. So that's going to be the first thing that we do, and then we'll go over to the traction table and talk about that. The best way to address the disc itself in the office is going to be our decompression table. So what our decompression table does is it actually uses mechanical traction to pull on the low back, and what it'll do is it'll pull and then relax, pull and relax. And this table is actually on a slide, so it'll open up as it pulls more, and then as it relaxes, it'll retract back. So what this does is it gets the spine moving. It also, because of that back and forth motion, it actually creates a negative pressure inside of the disc. So if a disc is bulged or possibly herniated, it can start to pull that disc back into the original place and allow the disc to start to heal itself. So this, coupled with the adjustment itself, when we start to mobilize those joints, it's going to allow the disc to heal at a faster rate. So on our touchscreen, we're able to put in different maximum pull amounts. Our normal is 80 pounds at our peak and 40 pounds of minimal pull. So that's what happens is it'll pull up to 80, then it'll release down to 40, pull up to 80, and release down to 40, and it goes through that cycle quite a few times. Usually it takes about 15 minutes to be on the decompression table, and we usually do this before we do the adjustment. So the third piece of the puzzle for our treatment protocol for herniated discs is going to be to address the muscles. The muscles are so important because they help to stabilize the spine. If you do have a herniation, there's going to be a lot of muscle guarding because your body doesn't want the spine moving too much. So the two things that we want to address with the muscles are any kind of muscle tightness to try to help loosen that up and alleviate some pain there, and also to strengthen any kind of weak muscles. Now, our massage club is a nice affordable way for people to get regular massage in the office while they're going through their treatments. The therapists are able to talk directly with the doctors, so they're able to develop a treatment plan that works best for the patient. We also have a functional fitness center where we can do corrective exercises to help the spine start to get some mobilization in there and to help strengthen those core muscles that are so important when you do have a disc problem, because a lot of disc problems come from an instability in the spine and an instability in the core itself. So being able to strengthen those muscles and loosen any tight ones is going to be a really important piece of the puzzle.
Extension of the spine will help bring oxygen. Hi, this is Nancy talking to you this week about exercises and stretches for herniated discs. So we're going to go through 3 things that you can do to help the spine and help to strengthen the core area to help reduce herniated discs. So we're going to get on the floor and recline. And we always want to brace our core when we're getting down to the floor, first of all, but then we're going to do some basic foundational strengthening exercises that's going to strengthen the core. Let's do a reverse crunch. And for this purpose, to avoid adding extra stress to the spine, we're going to just keep our knees over our hips and make it a pretty small move. We're going to exhale, pull the belly button into the spine and lift the hip off the floor, and then inhale and come right back to that beginning position. Exhale and inhale. And we could do 2 sets of probably 10 to 15 of these depending on your fitness level. Exhaling and inhale is going to be really important because that'll engage the appropriate muscles as we go through the exercise. So that's a reverse crunch. We keep the head back in this case to keep stress off the cervical area of the spine. And then we're going to reverse that exercise and do a shoulder bridge. So if in our shoulder bridge, we do want to bring our feet to the floor, have your feet hips width apart, knees over ankles. And as we exhale, we want to do a pelvic tilt. And to do that, as we exhale, we're going to pull the belly button into the spine and flatten out the lower back. And then gently lift each vertebrae up into a bridge where you're on your shoulders and feet and the hips are off the floor. We don't want to hyperextend here because we don't want to curve the spine any more than's necessary to engage the glutes and the hamstrings. And then inhale, lower your hips back to the floor. And then again, we do that the same amount of reps that we will have done for the reverse crunches when we work the front side. So those are 2 strengthening exercises that we can do to keep the muscles balanced to support the spine and provide spinal stability. And then we're going to stretch the lower back out by putting our arms out into a cross position, leaving the feet on the floor. We're going to inhale and lower the knees side to side. We're going to inhale and lower the knee. And you can stay here in this stretch, or you can exhale and gently and slowly come side to side, only twisting as far as your back and hips will let you, keeping shoulders on the floor. Exhale it across, inhale when you come, bring the knees to the side. And we want to keep that really gentle so that we don't aggravate the spine. But it's going to help loosen up the lower back and maybe even strengthen some oblique muscles as well to add, again, additional core stability. So those are 3 exercises you can do for herniated disc. That's the Fitbit of the week. Thanks. Come back next time.
So that's our treatment protocol for herniated discs. Remember, the 3 things that we care about are going to be the joint function, the disc health itself, and then the muscle, either tightness or weakness. So if you have a herniated disc or you know someone who's dealing with one, the one thing that I can recommend to you is to make sure that you try every conservative option first. Surgery is always there as a last option, and you want to exhaust all other options before you head down that road. If you do know someone that would find some benefit from this video, make sure that you like it or share it with them. Thanks a lot.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.